I'm back in the studio with Ryan. We are recording the podcasts. You were worried. Everyone was on me, the DMing. And when are you coming back? I'm here. I never left. I just wasn't recording. So I guess technically it's not quite here. But you could have just followed me on Instagram.
Yeah, you're too busy training for a marathon.
It was the high rocks, Ryan.
You traveled all across the world to physically exert yourself.
I almost died. Like multiple times. And when I came forth, was so infuriated with myself that I bought a treadmill. I have set it up in my living room. And now I wake up and stare at failure in the face.
You just added a treadmill into your house with already a massive amount of human beings that live in it.
That's right. I added an indoor jungle gym and a treadmill for myself because in this High Rocks competition, I did great on the workout portion, but I completely sucked at the running portion. Like my kilometer splits were just garbage. And so I did what any normal person would do and bought a treadmill so that I could work on them.
Well, 2025 is the year of getting in shape. You have your new treadmill. You have your energy makeover.
That's right.
Helping other people get into shape.
Honestly, not only are they getting in shape, but last week I had 3 participants who have been my patients for quite some time, actually. And all 3 participants have endometriosis. And my spiel on how activity can benefit endometriosis, specifically from an inflammatory standpoint and reducing pro-inflammatory cytokines, for example. My theory has been proven correct as these individuals who joined the Energy Makeover in December and have been doing it now all the way almost until March have gotten their positives. 3 positives, Ryan. 3 positives 1 week. What?
Yeah, so all the listeners need to hop on the bandwagon, and 2025 is the year of improving our health.
Ryan has also improved his health.
Yes.
Tell us about your journey, Ryan.
Well, I've turned 30 years old, and even though there's some people laughing, being like, you're still a baby, like you do. You always call me a baby.
I would reject you as a patient.
But I had a pretty wild 20s. So I kind of let myself go a little bit. And I was like, you know what? I'm turning 30. It's time to get back to being a normal, healthy person. So
what did you do letting yourself go?
Well, I drank too much alcohol, number one.
Yeah.
I loved getting home and just drinking beer. It's kind of one of my favorite things. It's still one of my favorite things. And then just diet. Doing this podcast opened my eyes to there's so much crap in the world. It's so easy to consume. And I was just consuming crap all the time. So I just started with, what can I do to fix my diet, eat real food, cut out the crap. And then eventually I'll start working on like macros and stuff like that. But it just started at cutting out the crap. And then it was going back to the gym. I started 3 days a week. Now I'm at 5. So before, when I tried to get in shape, I made the mistake of trying to go from 0 to 100.
Yeah.
So this time I was taking baby steps towards, I'm going to start with this, then do that. So that way I'm not going to burn myself out. And honestly, one thing I've realized is I was so ready to be done with some of the stuff I was doing that now, like, I'm 2 months in and I feel really good. I feel like I'm going to like continue to go and be consistent. So
I was, as you were speaking, just in my brain chirping consistency, because that's the biggest hurdle that people need to get over, this all or nothing approach. Because I blame influencers because they're a day in the life, for example, they're like, hey, come live a day with me, where they're like, for breakfast, I'm going to start off with, my filtered water from my well that just happens to be in my backyard. And then after that, we're going to do a sun salutation. And then after that, we're going to go and get a full body massage. And then we're going to work out. And then we're going to drop off our kids. And then after that, we're going to go and consume only protein. And then we're going to start off the afternoon with like meditation. And then I'm going to work for 15 minutes at my full-time job. And then after that, It's just ridiculous.
Yeah, I think that's the key. It's also finding
It's not
something
sustainable.
It's finding something that works for your lifestyle too. Like I think you just hit the nail on the head right there. That's someone who has all day to eat as much protein or to cook as much food or to exercise as much as they possibly can. A lot of people don't have that luxury.
But they're not even doing that.
Yeah.
Like, I don't believe you.
No. So it's also just findings for someone who is a busy person like yourself,
Right.
or like some of your, like you don't eat a lot of breakfast. You kind of eat what and when you can, the healthiest you can. So I think just finding a way to incorporate the healthiest way you can incorporate good stuff in your lifestyle is just kind of what you have to do.
Yeah, I think you have to have a core set of non-negotiables and then move from there. My like core set of non-negotiables, 4 workouts a week. They have to be 40 minutes or longer. I've built up to that. Where I don't eat grains and I don't consume dairy. Non-negotiables. I, for the most part, don't drink alcohol at all. It doesn't sit right with me. As much as I love it, I wake up, I feel terrible.
Yeah, you feel like shit.
I actually feel terrible within an hour of consuming it. But I think I'm nostalgic from like, I don't know, 10, 12, 15 years ago when I would have a glass of wine and be able to relax. Now, if I have that, I just have a migraine. Those are I'd say my 3 main non-negotiables.
Yeah. Mine's just stop eating, like no more bags of chips. Like I'm just starting with that. Like no more
Snacks.
Anything that's in a bag, like I'm not eating. That's like shitty for you.
So no ultra processed food.
Yeah, no. Like that's just like out the window. Like,
that's great.
Yeah,
that's a good start.
That's what I'm starting with. And then also like it was just my birthday, I'm gonna have a couple drinks, whatever. But
yeah.
If I'm going to crack open a drink, it's going to be worth it. It's going to be for like an occasion and something. Just like having a random drink on a Wednesday night is just not happening anymore.
It's not on.
No.
Like
no
what
point.
is
What's
the point
of doing exactly?
Self-sabotage.
Yeah, 100%.
Yeah, I hate that. Right, guy. I feel like this has been going so like relatively well. This I'm getting off. What was it? What was I doing? I'm shaking off the rust.
Yeah.
You don't really shake.
I thought I'd help you out and join in here.
I really appreciate it. What is it? You like grind off the rust?
No, you.
I'm not a mechanic.
Yeah, I don't know. I don't know what you do.
I'm buffing off the rust.
Yeah, exactly. So that's why we're coming back with another AMA episode.
Yeah.
Where all your loyal followers and all your fans send in their questions.
Yeah.
And we filter through them and then we pick the best ones. And then I proceed to ask you the questions and you proceed to answer them. Okay, so question number 1. Recovery after miscarriage and advice on how to proceed with conceiving after loss.
Well, first and foremost, I really empathize that this is a question that you're having to ask because it more than likely means that you have gone through a loss. And as somebody who has gone through 5, I understand the sting of that and the fear that also comes along with a miscarriage. My sister, who has never had a miscarriage, when she got a positive result on her pregnancy test, just lived in this, in my like opinion, as I was watching her, this like carefree, enjoyable experience. Whereas I started off my fertility journey with a miscarriage. And so every subsequent pregnancy has been marked mostly with fear until I got past the number of weeks pregnant that I was when I had the most recent miscarriage. In terms of like preparation, testing that one should be doing. If you've had one loss, you need to keep in mind that unfortunately, 1 in 4 pregnancies is going to end in miscarriage. And it doesn't mean that there's something wrong with you and that something is very seriously wrong that will be replicated time and time again. More often than not, it's simply an issue of not the right sperm, not the right egg, and from time to time, not the right environment. But all of those factors cycle through. You'll have a whole new lining, a whole new egg, a whole new sperm each month. It's issues that let's say you've had more than 3 losses back to back, that's when it becomes more problematic and you might want to consider immune testing and a thrombophilia panel, so like a blood clotting disorder. If that is not where we are at and we are simply dealing with like 1 miscarriage, I think the most important thing that you can do before needing to jump into more serious intervention would be to get a semen analysis because I think it's very important to know whether or not your partner has very high DNA fragmentation. Because if that's the case, you find out that your partner's fragmentation is over 20%, then I would want to ensure that that was corrected before you tried again. Because 50% of all miscarriages are due to high DNA fragmentation. And so knowing that it's not an invasive test, it's easy enough to do. And much to the chagrin of a lot of the REIs that I work with, the only thing that you really can do most of the time is make lifestyle changes. Which I always think is so funny. They're like, well, there's nothing you can do except completely revamp your life. So really almost nothing. Nothing that you can do at all. So know what your partner's DNA frag is. If you find out that it is high, get an ultrasound to rule out any varicoceles. Make sure that they don't have any infections, and then make the appropriate lifestyle changes, supplementation for sperm quality, as well as making sure that no one is too hot. So boxers, that's always like a mind-blowing one. I had 2 initials in the last week where I told the men, you need to choose boxers and not briefs. And it was like, I watched this light bulb go, boing! It was astounding. Like I was some sort of genius with this suggestion. Anyway, make sure that you fix the sperm and make sure that you are prepared with a good mental health support system, because you are going to have a hard time for the first however many weeks until you get past the point at which you had your loss. And even then, I do find one of the things that offers a lot of my patients a lot of support is if you are at a fertility clinic and you are able to get the ultrasounds from week 7 to week 12, having that weekly check-in, it works wonders, because you can then, although it's short-lived, you can have that 24 to 48 hours after your ultrasound to breathe. And then you just work on getting through to the next week. Gives you these small stepping stones to a brighter future.
Can you do core workouts when trying to conceive?
Yes, absolutely.
Elaborate.
Okay, so let's say, if you were trying to conceive spontaneously at home, you have no limiting factors at all. 0. If you were doing IUIs, you have no limiting factors at all. It makes me completely mental when people come in. I don't know who is spreading this insane rumor that during your 2-week wait, you have to live this ridiculous horizontal life where you're basically doing nothing and being ultra careful about not creating any intra-abdominal pressure. That's mental. That's insane. Why? Do you think throughout history that women have just lain around for half of the month waiting to see whether or not they were pregnant? And what then? You continue just lying around? It's completely mental. You are not that fragile. Now, my patients who are having done an IVF transfers are all listening to their podcast with their headphones in, just being like, what? You made me lie around horizontal for 2 weeks. That is a different scenario. When you are trying to conceive spontaneously, it is less of a delicate situation than if you are putting an embryo into the uterus via catheter after it has been thawed, after it had been frozen. Prior to that, it was biopsied. And before that, it was taken from your ovary and then injected with sperm. The whole process is a much more fragile process. And so you do have to allow for a little bit less activity, including but not limited to core workouts. I always say until about 6 weeks. So about 4 weeks post-transfer. I really want people to live their best life and actually move their bodies, because I think a lot of the issue with fertility and with the time that people are putting into fertility, it feels so much longer when you live your life week by week. Period week, ovulation week, and then a 2-week wait. Your life sucks. So then when you get to that 6-month mark, that year mark, of course you are really counting time. And it is a huge wait. That is who you have now become. That is your identity. No, try as hard as you can to not allow that to become your identity. And just know, the only thing I ever tell my patients that I deeply care about is that they have sex during the right window and that they eat as well as they possibly can. I give them a list of foods that I would prefer them to have more of and less of, and to try and get in daily movement. Sleep as much as you possibly can. Try not to do things that you don't enjoy. I don't ever say stress less because that's dumb, because then you're stressed about being stressed. But try to do things that help manage your stress and focus on that as opposed to this arbitrary, like, don't stress. I'm stressed now, just even thinking about not stressing. What if I want to stress?
I feel like for this question, we've covered this so many times. So I don't know what we need to do. We need to pin something. We need to post it all over the world. We need a giant
sperm doll.
Yeah, a giant chalkboard in here with
Right.
all the things.
This is because we are quite literally the only people, other than that one TikTok, talking about sperm. Did you see that stupid TikTok? Where I had so many people send me this TikTok where they were like, did you know that men are 50% responsible for the health of a pregnancy? I was like, are you dumb? My kids have known this since grade 4.
Okay, so the question is, best way to improve sperm motility and reduce fragmentation?
This is controversial, and I am going to hype this fact up because I don't think it gets enough attention and because I'm not sure how uncomfortable it's going to make you. Are you ready? You know what the best way to reduce fragmentation is? Frequent release. Don't store them up. Clean the pipes. So they did a study where they encouraged participants to masturbate specifically 3 times in a 24-hour period. By the time they had their third release, the fragmentation in that sperm had 20% less fragmentation.
Okay, this is I haven't heard this before.
And you're encouraged.
Well, first of all, 3 a day. That is insane.
It's not that bad.
3 a day? I know all guys are different, but that's insane to me.
Bring yourself back to being like 15.
I think even when I was 15, I didn't do that.
Maybe you're too busy. If you were sitting around alone in your room, you had nothing to do. These guys are literally in a study. They're nothing to do. They're like 24 hours. What else are they going to do?
Well, that's interesting. That's a new piece of information. I do think it's kind of insane and whatever, but that's the first time I've heard that.
Well, it's very interesting I typically do see when a patient's count goes up, their motility will go down, which is something that I've spoken about before. The idea of if you have a very crowded race, I've used this analogy, then the good runners are not going to have the easiest time getting to the finish line because they're slowed down by all the corpses in this zombie race that is sperm release.
It's almost like if a race started
Yeah.
and you let all the slow people get way ahead.
Yes.
And then you let the elite runners start later and have them try to navigate through everyone and try to like catch up and get through.
No, it would be like throwing out the bad runners in a sock or a handkerchief.
Yeah, this example. Sock.
You throw out the dead runners into a hanky, allowing the best runners to run their best race.
Mm-hmm.
That's what would ensue.
Now, does it have to be that extreme? 3 a day?
No.
Or is it just like maybe try to do it as much as you can?
Traditional advice has been, because fragmentation hasn't been given enough attention. So the most common advice that you hear is every other day through the fertility window. And I myself have said that to people. But that is mostly, I'm trying to maintain my patient's mental health because I don't want them having to freak out about, oh, I missed a day. But if you're looking at sperm being the issue, like this, here's a great example. With IVF, patients don't need to worry about the count. They don't really need to worry too much actually about motility. They need to just worry about the quality, like the morphology and the DNA fragmentation of that sperm. Because you don't need more than even 100 sperm. So you don't need to worry about if you frequently release not having sufficient amounts.
Let's just hit. Give me 5 things that men can do right now. Don't elaborate on it too much. Just 5 things men can do right now to improve their sperm.
Number 1, watch your heat. No hot showers, no saunas, no baths. If you wear layers to work, don't. Wear boxers, don't wear briefs. Don't put your laptop on your junk. Don't put your pet on your junk. Don't put a pillow on your junk. Leave your junk alone. Number 2, don't smoke. Don't smoke. Just don't, generally. Like, what kind of father are you going to be? You're going to be on the sidelines shooting darts? Your kid's going to be like, yeah, that's my dad over there. He's probably not going to make it to my wedding. Because literally, that's what's going to happen. I'm sorry. I know that's a controversial thing for me to say. I don't care. You're not going to be as good of a parent if you smoke. Stop now. Number 3, give up THC. And the reason why that's not included with the smoking is because it has a whole other issue. It's not just fragmentation, it's also motility. You are high and so are your sperm. It is so irresponsible for you to not give up cannabis when you are trying. And I don't want to hear this whole song and dance about how, oh, well, it's good for my mental health. I'm just so stressed. If your pregnant wife all of a sudden started smoking weed through pregnancy, you would have a complete shit fit. It's the same thing. It's insane. Number 4, please take your supplements. There are so many studies that prove that it is super beneficial. If you are seeing a kind and compassionate acupuncturist or naturopath, they will even go so far as to give you supplements that you can chew or pour into water because it seems that swallowing pills seems to be a massive issue. Number 5, lastly, move your body. The most improvement that I have seen where nothing else has worked, for instance, I have 2 patients right now where their count was an issue. They had varicocele repairs. They changed their lifestyle by way of like sleeping more, less stress, taking their supplements, avoiding heat. But then the last thing that we changed that made the biggest difference was we added strength training into their life. Not cardio, strength training. Improves circulation without increasing overall temperature. Big win. But also, it improves your testosterone, which therefore improves your sperm. Win, 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 win.
What is the age of the oldest patient you've supported during their pregnancy?
44. Well, I mean, technically, that's not fair. We have our gestational carrier. She's 55. Using her own eggs and spontaneously conceiving, 44. Using her own eggs after they had been frozen, like as embryos, 47. So she froze them embryos were frozen when she was 39. And then she ended up using them when she was 47, which I thought was pretty cool as a riddle. Because technically, that baby is 8 years older. And like Austin Powers, they were cryogenically frozen in time.
And he didn't get older.
Cool, no?
That is kind of cool.
Yeah.
Can high AMH at 35 be an issue?
Yep. You could have PCOS. I have one patient, she's my favorite to speak about in this particular capacity. And her mother was trying for her and her sisters. There's 4 of them. And she was trying to conceive from the age of 28 until 35. She had PCOS. They even did the old school technique where they took a portion of her ovary out in order to lower AMH to encourage ovulation. They didn't have, letrozole was not an option at this time. And she genuinely was about to give up and then went on to conceive spontaneously, my patient, at the age of 35, and then had 3 more kids thereafter. PCOS, there's a lot of frustration that's involved with it because your ovulation is irregular. Sometimes you have elevated testosterone, which can be problematic from like a skin and hair standpoint. It's tough because your insulin is often an issue. But one of the real wins for the most part is having high AMH. Now, not all PCOS patients have high AMH, but if that is you, you're like Benjamin Button, my friend. As you get older, your capacity to have normal ovulation will just increase with each passing year. Like a baby. It's the best. I'm obsessed. I'm obsessed. It's my favorite. People will come with PCOS. I'm like this slam dunk. I don't have any patients that have PCOS that I've not been able to help.
Well, that's encouraging.
Broad statement, but it's true.
Yeah. Well, that's good to know. Anyone who has PCOS, you know where to go.
Lifestyle.
Yeah. What's the best postnatal vitamin?
I like Mega Food. They've got the prenatal is Baby and Me Too. And then the postnatals, I don't even know what they keep renaming it. But Mega Foods Baby and Me postnatal vitamin. My favorite. It has a high amount of chlorella, moringa, and choline, all of which is beneficial for babies' brain development and also for milk supply.
And we weren't even paid to say that.
That's right.
So you're welcome.
Because we have no sponsors. Help us.
Yeah, you're welcome.
That's right.
Okay, this next one's kind of funny. So when I first started working with you, I was obviously didn't know anything about this area. So when I was uploading your videos on YouTube and putting tags on them, I kept seeing TTC.
And you were like, why is everyone on the train?
And I was like, what the fuck is TTC? I have no idea what this is. And it took me about 2 months to find. I didn't even Google it. I could have just Googled it and figured it out in 2 seconds, but I'm just an idiot. So eventually I figured it out. So the question is, if you were trying to conceive TTC, what would you and hubby do to prepare?
First, I would have to create the illusion of interest in sexual intercourse so that he wouldn't be totally taken aback. You want to do what? When? Regularly? More than once? Every couple of months? Okay, in all seriousness, what did I do? First and foremost, I worked on improving Yavor's sperm. Because, and this is something that I don't think enough people talk about, is if it's never been a concern, like a lot of the lifestyle things that we think are really good for you, like he was really into cardio because he was a personal trainer. So he was trying to lose weight. He was all the time, he was on the bike, which is not great because it increases heat for 2 reasons. So took him off the bike, put him on supplements, and actually had him getting regular semen analysis so I could see the improvement, which was a bit awkward because we were not together for a super long time before I said, hey, I'm supposed to go into menopause in a year. So I would like to have another child. So why not get this show on the road?
Not very surprising coming from you, though.
Yeah, he was a good sport.
Yeah.
He was like, I said, have you ever thought about having kids? He was like, I guess. I was like, all right, well, if this is going to continue, I suppose you should make this decision up quick. You know what's really funny? I had a patient today who was like, I don't know if I'm ready, I don't know if my husband is ready for a third, but I really want one. And I was very un-PC. I was like, well, why don't you just trick him? And she was like, because if he knows that I'm ovulating, he won't come near me. And I said, well, then lie. And she looked at me like this was a genius idea.
Yeah.
Like it never occurred to her.
Honesty.
Oh my God. I tricked Yavor into my last 2.
Yeah.
Boom, boom. Why would I want to have sex with you in the middle of a month? Come on. There's no other reason.
Men are stupid. You can fool them.
Honestly. Put on like a nice dress, some heels.
Yeah.
They're not asking questions.
No.
In all seriousness though, like let's say for example I was going to do IVF, what I would do to prepare. I would get both me and my husband on a good supplement program. I would have both of us moving our body on a regular basis for at least 90 days. I would have a full checkup with my GP to address any other underlying concerns, because I find that a lot of the time, some fertility clinics are really excellent. Like Hannum, for example, they always check thyroid. That's not always the case with other clinics. And your thyroid health, for example, is going to impact your overall health, specifically how well you're going to do with stims. And so it's really important to make sure that it's regulated because sometimes it takes a lot longer than just one cycle. So it'd be very frustrating if you were like, okay, now I've decided I want to have a baby, or now I've decided I want to start my stims, only to then have to wait for your thyroid to regulate. I would also be getting regular acupuncture because studies have proven that it helps reduce FSH and improve AMH, whether that's from a PCOS standpoint of lowering it or a diminished ovarian reserve standpoint in increasing it. I'd also want to make sure that my vitamin D levels have been tested because often low vitamin D levels are associated with an incorrect reading of your AMH. So patients, for example, who come with all of a sudden an incredibly low AMH where previously it had not been, most of the time I'll have them have their vitamin D levels checked. And once we've started regular supplementation, it boomerangs back up. Your AMH is very much affected by inflammation. And so you can also ensure that you're living in more of an anti-inflammatory way, making sure that you're getting enough rest, you're moving your body in a way that is relatively moderate as opposed to either too much or too little. I find a lot of people go really extreme and they take leaves from work. I have never seen that be effective, ever. And I think the idea of I'm going to take a leave from work so that I can focus on my fertility is a great idea. In practice, I don't think it works because then I think you're become hyperfixated on something that you were already hyperfixated on, except now you have all day to only think about that. And so this idea of like taking off time to have less stress becomes significantly more stressful.
All right. Well, I think that's going to do it for this AMA. So
Okay.
there's more of these coming in the future, and you will notify everyone when they need to set in more questions. We also have some banked questions as well.
If they even like these, what if they hate this episode?
Well, why would they hate this episode?
I don't know. It's a lot of me.
I don't think anyone hates this episode. God. Sometimes you need a break from the whole guest experience. You need more Anne. We need more knowledge. We need to continue to drive these points and this knowledge into people's brains, because I feel like from a year from now, if we're still doing this and we say send in your questions, I guarantee you they will look exactly the same as these questions.
Well, I think that's definitely the case. There are some overarching themes for sure.
I feel like it's hard not to be repetitive because it's just someone might miss this episode, but then a year from now they're going to be in it and they're going to be like, how do I improve my husband's sperm? And then we're going to have to come back. We have to say it all again.
Yes.
So it's just driving home the points of live a healthy lifestyle.
Yes.
Eat good.
Yes.
Good supplements.
Yes.
Wear boxers.
It's not complicated, but it is challenging.
Yeah.
This is the key.
Yeah.
Most things are that you're supposed to do. We overcomplicate everything. I will say, in a little shout out, right now, I do have a lot of guests in terms of like experience and expert-based guests. I regularly have patients say, one day I'm going to be on your podcast, but I haven't had a call out in a capacity where I'm asking people, if you want to be on the podcast and share your story, you don't have to be a patient, but you just have to have a fertility journey that you want to speak on. Yeah. And if that's the case, send us a note.
Yeah. Storytelling is how people can learn they're not alone in the journey of.
Well, I'd love for the listeners, especially because, for example, a lot of my patients, their goal is to be featured on my story as a positive pregnancy test. And like in the last 2 days, I've had 10 pregnancy tests. So that's how they show up in waves. But I want them to have also the capacity, if they are interested in coming on to the show, to be interviewed so that they can tell their story. So if you're interested in coming in, telling your story, whether you are, living in the States, the UK, Australia, we will figure it out via Zoom.
And we'll do virtual.
But we would love to feature you.
Yeah, absolutely. And don't forget to go to our YouTube channel, Trying to Be Positive, subscribe, watch our videos, like all the videos, comment on all the videos, leave a 5-star review on Apple, leave a comment. Every time we get a 5-star review, we get on that education chart and more people find us. And then Spotify, just leave 5 stars there.
And speaking of the YouTube channel, we have 6 new workouts that have been uploaded onto the YouTube channel.
Yeah.
So if you are finding that you don't know where to start, there's an exercise video for you of varying length and ability level. Get started there. They're free, they're easy, and you get to spend more time with me. Thank you so much for listening this week. Every time that you listen, you share, you rate, you review, it helps boost our show, which not only gives me the motivation to carry forth, but also helps attract new guests with new information. So thank you so much. Please don't forget, again, rate, review, subscribe to our YouTube channel, and we'll talk to you soon on the next episode.